My father had a horrible PTSD from World War II. He used to drop bombs on German ships. And German ships did not like being blown up. Out of 10,000, 100 made it home. So he's one of the 100. So he got married to my mother, and he gave my mother PTSD. It's called secondary PTSD. You can actually catch PTSD. My mother took her life.
Oh, I'm so sorry.
I switched from surgery, just exhausted. So I switched to anesthesia. From anesthesia, I went to pain medicine. In pain medicine, I was doing procedures. I wanted nothing to do with psychiatry. She saw a psychiatrist. This is not going to be something I really want to deal with. I worked hard to get a PhD. All right. Yeah. Welcome to the next edition of Brain, Hope, Reality. In the last couple of weeks, I have done one from San Miguel, where we are amazingly excited, our family, to have our home. And I did a special one on Day of the Dead. I did one yesterday from LA. I was out there doing some stuff. I learned a new word. It's kind of interesting. It's called properly crazy. Properly crazy means like properly eaten, properly hungry, means you're really crazy.
I like it.
About that. It's a cute term, isn't it? Anyway, I have absolute pleasure today of having Dr. Sara Jahnke. I'm sorry if I'm mispronouncing it.
Oh, good.
She's a PhD and is like a for real scientist. She loves and does a lot of work with special forces. So you can look at her beautiful shirt. Maybe you can show more of that shirt. That looks beautiful. That's what I'm talking about.
Thank you.
So you got a firefighter in there. You got Einstein in there. What's the logo? Is that Adam?
That's better. So this is Science to the Station. That's our organization that we started to translate science to practice. Yeah.
You have to send me that shirt.
Yeah, I can make that happen.
Yeah.
That might be weird, but I have a clean one.
No, yeah. I'll feel it a little different than you, but we won't go into that. Anyway, welcome aboard. And I thought we can have a pretty exciting discussion. The focus here will be first responders. I think firefighters and police, I think people are really absolutely underestimate what they do for us. And when you're in trouble, you really need them. I used to be a trauma surgeon in county. I had the best relationship with first responders and the police. Without those guys, a lot of bad things happen. Morons shoot at them. I mean, somebody's trying to save somebody, resuscitate, and they're being shot at.
Right.
Morons. Anyway, all those morons, you can turn off. We don't like it. Anyway,
you're not welcome.
I think we got to move on. So it's interesting how we met. So we were both giving a speech in Missouri to first responders. And I found Dr. Jahnke's speech, first of all, fascinating and a very dry subject. So in order to be able to do that and infuse enthusiasm and
dry subject,
it's boring. Yeah. What are you talking about? All those numbers, all those graphs?
Sleep, cancer, cardiovascular, like what more?
No. I don't think science. Okay, how about this? Let's agree it's not dry to you.
It's not dry to me, but I do understand.
Let me ask you this question. Did you have a lot of graphs?
Well, yeah, because you have to like get your point across. Picture is graphs, 10,000 words.
It's dry. But I mean, I was trying to give you a compliment that you presented an amazingly important subject in a way to be able to digest it.
Yeah, that's fair.
We agree with that.
That's fair.
All right, we'll stop with that. Anyway, so one of the things, we had a little second here to talk first. So I'm really excited about talking about BTBI, which is blast traumatic brain injury, and TBI, traumatic brain injury. So we were talking about terminology. So I am somewhat of an expert on BTBI, or blast traumatic brain injury, traumatic brain injury, and special forces. The reason I am, I've had absolute honor to take care of a lot of SOF guys from the United States and Canada. In fact, I just recently published an article, 2025, using something called SOF protocol, Special Operator Force Protocol. And the reason I got into it, I did a special force weekend. So a bunch of old guys running around blowing stuff up. So we blew off hinges of a door using cord, blah, blah, blah. My head was like woozy. So I went to the instructor and I said, my head is woozy. It's such a wuss. We usually use C4. this is called eating a charge. So I said, that's not good for your brain. So I looked at it in detail. So BTBI is a thing. So if you have the explosion next to you, IED or a gas tank that explodes, which never happens in fires, I'm sure, and you get thrown, that's probably BTBI. So if I ask a fire person, have you had TBI or BTBI, they'll probably go, what are you talking about? So if you can introduce the technical term you shared with me, I'd like to talk about that.
Very technical. Well, and like I was sharing that we started having this conversation in the fire service, and I think people just don't understand what it is. And so, or they don't recognize it for what it is. Like you said, he said, oh, that's just, taking the charge. In the fire service, when I asked that question, hey, have you ever had a concussion or I've done a couple of presentations on it, and people just say, no, no, maybe one or two people will raise their hand. When I say, have you ever had your bell rung? Like half the room goes up, and I'm like, okay, so that's what we're talking about. But it's interesting that it's like you said, it's just perceived as normal. Like this is just part of what
Yeah, it's
happens.
normal. You get bib up in the head, knocked out a few minutes. So for those people who would like to recognize what bell rung means or TBI or BTBI is, it's really simple. You don't have to necessarily be knocked out. Obviously, the longer you're knocked out, the more severe the injury. That's straightforward. However, let's say you have the bell rung lightly or a couple times, but you didn't get knocked out. And let's say next day you have a headache. And let's say you go out and the light bothers your eyes. That is a TBI or a concussion. When the light bothers your eyes, you have a headache and you're nauseous. You got it, right? No matter how you phrase it, no matter how terminology is. But the question is, why is it so important to identify? And that's this we're going to get a little bit sciencey here in a second. And I'm curious to see why I think I can give you a very interesting perspective, I think, because I was talking to a head of NIMH, Dr. Insel, and he says, Eugene, you come up with the craziest idea. Where did you get that? I said, because I don't know the literature, what I'm into, so I know nothing. I started as an empty plate, right? So I figure stuff out. Anyway, so when an athlete gets injured or they get TBI, they tell them to sit out a couple of days. They don't want to send them right back. From your perspective, why do you think it's done?
What do they
Why is that a common practice? And I agree with that practice. I'm just curious,
Yeah,
from your perspective, why is it important to have an interval before there is exposure to possible other TBI?
for recovery, right? And so they have the
But why?
time to
What's recovery mean? From what? There's no blood in the brain. You did a brain scan, there's no blood, nothing. Clean. CAT scan is normal, no headache, no nausea, nothing. They're still going to tell them to have an interval. Why do you think?
So, well, tell me, because how good are we at diagnosing TBIs?
Pretty poor. However, let's say somebody gets hit in the head and they have a headache and they have light sensitivity and then nauseous for a day. That's a diagnosis right there. Let's just agree on that. I'm not
Right.
talking about subclinical. We're not sure. So how about it? Let me give you the answer I'm looking for because you may be surprised by the answer. And the reason I'm interested in that is because I can do something about it. That's the key, right? And I'm curious to see your perspective of TBI. So the standard, when I went to med school in 1984, so a few years ago. Anyway, the idea was if there's no blood, it's a mild hit in the head, big deal. If there's no real blood, so what? It goes away, just keep doing things. But people have found that even if there's no blood on CT, which is pretty sensitive piece of equipment, and you keep hitting it multiple times, it seems to get much worse rapidly. So one of the questions I was interested in, why does that happen? So I'd like to know why, because if I understand why, maybe I can do something about it. So the thinking I have currently, and I'll give you the background behind it. So when I did the SOF method, I found that ketamine and stellate together is synergistic. So ketamine, everybody's pretty much heard of, but it also repairs nerve tissue, which is really nice. Stellate reduces fight and flight nerves, but it does something else. It reduces the immune increase. So there was a study done in China where people had car accidents. So they took 60 people after severe car accidents. They all had, I think they all had TBI, whichever way they defined it. Have got stellates, have didn't. The people who did not have stellate had an interleukin 6 increase, meaning there was an immune surge. Once you have an exposure of the brain substance to the blood, there is an autoimmune response to that. So what does the damage in TBI? It's not the hit. It's a secondary TBI. The interleukin 6 macrophages, they start to injure the brain, right? So the people who had the stellate had an interleukin 6 drop and much less TBI symptoms because it prevented secondary effect, right? I think that's the key. So when I gave speech, and go ahead,
What was the timing?
that was done within 2 days.
Nice.
So the idea, I mean, so this is, I went to Fort Bragg where they do, I think, 100,000 jumps a year, extra jumps, and they
Sounds
got a
awesome.
lot of TBI there, right? So my suggestion for them, study it. When they jump out of the plane, if they end up in the emergency room, get a stellate in all of them, it'll reduce TBI. They didn't do it. However, now they're actually studying this concept. So Fort Bragg, Walter Reed, and Northwestern are doing a study looking at a SOF method, trying to treat TBI. But I think the reason the interval is so important, if you don't wait whatever the amount of time, you're not reducing you're not reducing the immune response. So when you get even a smaller hit next time, it's much more damaging as opposed to if you didn't have the interval. That was the answer, in my opinion. Not interesting.
Since
So the whole thing is looking at TBI as autoimmune response to exposure of the brain substance. So blood-brain barrier is what usually keeps everything at bay, not exposing the brain. But once you violate it even a little bit, you have autoimmune response, and that starts to really screw up the brain.
So what made you think to add ketamine to it?
Well, because we had a guy who was suicidal, homicidal, TBI, he was a Green Beret, TBI, everything. So we added ketamine because we were trying to treat his depression. So stellate is
Yeah.
okay for depression, not as good as ketamine. So we were trying to combine the both. And then the guy who I was doing it with, he had a lot of experience CTE from football players. So we
Oh,
started
yeah.
combining those. That was the reason.
Interesting.
No weird.
That is weird. So, you said that you recently published on it. Have you started doing the trials, combining them versus just by itself?
Trial just stellates?
Yes, just one versus combined.
You live in a different universe than I do. I don't have the capability to do
I
stuff.
knew that's why I was like, "Oh, that would be very challenging."
Well, I would have no problem doing it if I had the cash. I don't have resources to do it. I'm just I've been pretty successful with minimal resources because it's like I think about stuff, but do I have a resource like you? Do you actually do real studies? However, I'll tell you one thing: there was a study done by a young man, Dr. Mulvaney, who followed my work. So he did stellates for TBI, and he saw a 52% reduction in TBI symptoms. When we
That's
did a
awesome.
mixture of two, it was 85%. So I think there is a significant impact. But again, has it been studied? I'd like to have a 3-arm study, right? Ketamine, stellate, and mixture.
That would be
Right,
really
study.
cool.
But right now, NIH doesn't have much money, and people don't have this, and blah, 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 blah. There is a reason why nothing was going to get done,
Yeah.
unless people who are private funders, and maybe we can do that study.
They should be listening to this podcast and then should reach out,
I
and
think
then
that's
we
a
can
great idea. Yes, if you can do it, no donation too big, no donation too small. I'm a chief science officer for Erase PTSD now, and if people want to donate money, it's a non-for-profit.
awesome.
Anyway, so we talked about terminology, right? So I love the term. Have you had your bell rung? I'm going to include it in my questionnaires. Um, so I am a big proponent of name change for PTSD. So PTSD is a term that started in 1980, right? So that is interesting. I don't know if you know the whole history of it. It's fascinating. So the
I
first,
recently learned it. So, but yeah.
so let me tell me the story. I mean, Maybe you can.
No, you tell it because I'm just learning it, but it's fascinating to me how I think like all due respect, I think they did like it was for a good reason, but I think we're missing the mark now. So I can't
Totally.
wait. What you
Absolutely. Absolutely. Well, road to hell is paved by good intentions.
think?
It's not going to be a surprise there are problems. Anyway, so the history of the term is interesting. So Romans had a term tremble 2,000 years ago. So after a battle, people are like, tremble. In the modern era, the first term that was used was called soldier's heart during Civil War. Then it was shell shock, World War One. Then it was battle fatigue, World War Two. Then it was Vietnam syndrome, whatever non-war that was. Then, interestingly, in Russia, they called it Chechnya syndrome. Remember when they went Chechnya and basically leveled Chechnya?
Yeah.
So interestingly enough, the symptoms were the same. I lived in Russia for a while. So the mothers of Chechnya syndrome patients had like a lot of letters saying our children are killing themselves. It's horrible. Symptoms are the same. Then in 1980, they termed the term PTSD, post-traumatic stress disorder. So this is DSM-3, which is Diagnostic Statistical Manual. What's interesting is DSM-1 and 2 considered being homosexual a psychopathology, which did not go particularly well. It was shockingly DSM-3 removed it. So then there was a gentleman, Frank Egbert, brilliant man. He came up with the term Stockholm syndrome. Well-known psychiatrist. He was number 2 guy for NIMH, National Institute of Mental Health. So he was part of terminology development of PTSD. So then, through more experience, he said, this is a highly stigmatizing term. We should need to get rid of it. And he came up with the term PTSI, post-traumatic stress injury, meaning there's a biological change in the brain that's real, that is not. If you can change the name, stigma will get better and people will survive. He combined his resources with a 4-star general, Pete Shirelli. So he was a 4-star for the Army. His job was prevention of suicides. So his soldiers went to him. Pete was not a doctor. He was just a line officer, 4-star. Yeah. Anyway, so he basically felt the same as Frank. So both Pete and Frank went to APA, American Psychiatric Association, in 2013, and they said, we need to change the name. The guys are killing themselves. The APA said, I don't think so. Not going to happen. So Frank now is 87, so he's getting a little long in the tooth. So he's handed this potato over to me. So I did a study in 2023. You can, by the way, any study I refer to is on my website, drugenelipov.com. You can download the whole thing. Anyway, so 2023, I did a study based on 3,000 people. We asked them the question, what will happen if we change the name? So number one answer is the stigma will go away. Number two, we will have more hope. Number three, we'll get more treatment. I take the whole study and I go to the APA again, attempt number 2. And I said, it's like, that's the study. This is what you guys did before. Suicides is at all-time high since World War II. Guess what they said?
No.
Nah, not enough information. In order to change the name, they can just change it tomorrow like that. And the requirement is you need to be able to demonstrate that it's causing harm. It's clearly causing harm. People are dying. That's causing harm, in my opinion. I mean, clinically, when something leads to death, we consider it bad. Go figure.
Not good.
Yeah, it's for a physician, that's kind of we object to that. Anyway, so what I'm doing now, actually, this is what I'd like to recruit your help. I have a website, itsptsi.com, itsptsi.com. And there is a survey. It's IRB approved and all of that. So I'm trying to shoot for 100,000, maybe a million people to fill this out. Then I'm going to go back to attempt number 3. I'm also trying to, once all of this drama with government shutdown stops, I'm trying to bring myself, special forces people, to the Veterans Committee in Washington on one side. The other side, I would like the APA people. I would like them to explain the rationale and their resilience to make the change to Congress people and see if they can explain their logic. There's no logical explanation for that. I don't feel like changing it. But we know it's killing people. You think this would be about time to change that? Because when people say, even, I was at a major fundraiser for military, and they're going, oh my God, this invisible wound, the invisible wound, invisible wound. I had enough self control barely. Because when I hear invisible wound, what I'm hearing is that true, if you have the wrong scanner, if you have the right scanner, like FMR, MEC scan, PET scan, it'll show you amygdala overactivation. Poof, go figure. You can actually see it. You can actually feel it and see it, right? Then you're going to believe that, hey, I have a condition I can actually fix. It's not a lifestyle, it's not a life sentence. Equally, in biology, right? So if you have a broken leg in a human and broken leg in a dog, they look the same, right? I mean, it's
Hmm.
obvious, like you have a break. If you have fMRI of a dog or a human's PTSD, looks the same, amygdala activation. So I did stellate for humans, right? Number of them, probably 5,000 by now. But I also treated now 2 dogs with PTSD, and they both got better, right? So it's a biological condition. Biological condition, you should be able to see it. You should be able to replicate in animals. Well, all that exists, it's real. It's not some amorphous, crazy concept that doesn't exist. And it actually, we know it kills people, but the fight goes on anyway. So yeah, I'm gonna get off my soapbox now. Those are my 2 terms.
No, but I'm fascinated by it. And I'm also, so I have to ask your origin story. How did you get into this spot doing this work?
It's a superb question because somebody
This
like me doesn't belong here at all. So, here's my story. So both my parents were physicians. I used to be interested in psychiatry and psychology when I was young because my family situation was spunky. It's a term I use for interesting childhoods. Spunky. Anyway, so we came to this country, and my father had a horrible PTSD from World War II. He used to drop bombs on German ships, and German ships did not like being blown up. Out of 10,000 flyers, 100 made it home. So he's one of the 100. So he got married to my mother, and he gave my mother PTSD. It's called secondary PTSD. So you can actually catch PTSD. So when I started my surgical residency, my mother took her life 3 months into it.
Oh, I'm so sorry.
Thank you. So I switched from surgery because I just couldn't do it anymore. I mean, I'm just exhausted and whatever. Anyway, so I switched to anesthesia. From anesthesia, I went to pain medicine. And in pain medicine, I was doing procedures. Like I wanted nothing to do with psychiatry. She saw a psychiatrist day before she killed herself. I was like, this is not going to be something I really want to deal with. Anyway, so then I had a patient years later that had severe hot flashes. I took care of her neck. I burned some nerves. She was happy. She said, I still have hot flashes. I sent to my brother, who's a brilliant physician, and he couldn't fix her hot flashes by doing whatever he did. He sends her back to me and said, why don't you try this? You do this thing called stellate ganglion block for hand sweats. I said, yeah. In fact, that's one of my core expertise. He goes, well, it's like maybe the whole body sweats the same thing. I was like, no, I don't think so. He goes, well, try it. I said, it doesn't work. He said, how do you know? Nobody's done it. I said, well, why don't you do it? I was like, okay. I do it. The woman disappears. Everything's fine. She comes back a year later. Says, I was great for a year. Can you do it again? I was like, what? That's crazy talk right there, girl. Anyway, so I did it again and she did great. So I called up my brother and I said, send me 10 more patients. So I do 10 more patients. 8 out of 10 got better. So I published on that. Then Chicago Tribune, they go, well, we'd like to interview you, blah, blah, blah. I said, fine, come on in, blah, blah, blah. So then this is what they wrote in 2005. We're getting to the answer that you asked me for. So this is Tribune, the biggest paper in Chicago, right? The first line was Bianca Kennedy, this beautiful breast cancer survivor, was so desperate to get rid of hot flashes, she let Dr. Lipov plunge a syringe needle in her neck. That's the beginning, right? Then they went to Northwestern when I went to medical school, head of gynecology. And they go, oh, this is terrible. This is just, yes, it works, but he doesn't know how to work. It's dangerous. We never trained him like that. Then they go to Rush, where I did my fellowship. And they go, oh, this is dangerous. This is terrible. What are you doing? What? We didn't teach you like that. What are you doing? Wait. So, so I was a little annoyed by that. It's an understatement. So I read about 3,000 articles. I was trying to understand why it worked for hot flash because it's never been described. I didn't know. Anyway, I figured out how white worked. And I wrote a paper in 2009 about that. As why I was trying to figure it out, I came across a paper from Finland where they were doing clipping of in the chest for hand sweats, and PTSD stopped. I was like, why would the PTSD stop from what? Whatever. Anyway, it turns out anatomically it's very simple. Once you know it, it's simple, right? So fight and flight nerves, sympathetic nerves go from the chest to the neck, from the neck to the brain, and it affects the same part of the brain. So I was telling my wife, and she goes, "You're full of shit." I was like, "What do you mean?" One thing cannot work for three different things. It cannot work for pain, hot flashes, PTSD. You're full of shit. And I said, I'll write an article proving you wrong. Anyway, so I called it Unified Theory of Cell Ganglion Block, and that was article 2009. While Northwestern gets $4 million grant to demonstrate stellate efficacy for hot flashes.
Uh,
Isn't that great?
yeah. Yeah.
So once I read that paper from Finland, going back a little bit, I called up on my brother. I said, hey, send me a PTSD patient, and I'll see if I can help him. He was robbed. The patient was 2 months after he was being admitted to psychiatric ward. I did a procedure, and he did not have to be admitted. So that led to my first publication in 2008. And here we sit talking today.
That's pretty good origin story. And I love that you published it out of spite. to just prove
I'll tell you what I remember. There are two things that went through my mind. In fact, the funny thing, Bianca, the beautiful girl, was a writer. She said, oh, I'm going to write it. And I remember there's a great saying, never argue with anyone who has ink by the barrel. They will bury you. So that was my mantra.
That's awesome.
And then don't get mad, get even. That's so, interestingly, so origin story gets even more entertaining. So I went somehow or other, I go to Congress, talk about PTSD treatments, right? Advanced PTSD treatments. The chairman Filner, in 2010, so he says, he listens to it, it's like, yeah, that sounds pretty good. And they say, how do you know you're not full of shit? How do I know you're not full of shit? I was like, Mr. Filner, the data will prove if I'm right or wrong. So meanwhile, I am where I have published tons of papers. He left in disgrace because he couldn't keep his pants on in San Francisco. So there
Happens.
you go. There you go. The bottom line is data. Good idea works if it works. So right now, about 10,000 special forces guys been treated by this technique.
That's awesome.
So isn't that a cute story, though?
Yeah. Yeah, it is. And that's why I love asking people their origin stories, because everyone just like, no one ever has a straight path, or at least the interesting people I know.
No, it's not typical, right? If it's typical, you're not going to be outstanding in anything.
Right. Well, and you couldn't have done that. Like if you had said, like, I'm going to set out to find a way to cure hot flashes and PTSD, like you wouldn't have thought outside of the box, right? You would have just.
Well, one thing I will tell you though, considering how I lost my mother, so when Tribune gave me shit, and I've seen how it all worked, and I understood that the impact I could have, it didn't matter how many people tell me I was wrong. I was like, I really appreciate your opinion. Thank you so much for that. Don't care. Really appreciate the feedback. Don't care.
Gosh, someone gave me a quote the other day. Now I've got to find it before the end of our talk, because it was the best quote about what you can do if you don't limit yourself. Okay. I'm going to find it. All right. Yeah. Well, we can talk about other stuff in the meantime.
Anyway, so I would love to potentially come up with a plan where you and I can collaborate and do a study to help first responders. So my big thing, because of my mother's death, is secondary PTSD. So we had really, I've published something on that space too. But I think it would be very interesting to look at the first responders, male or female, their spouses, because
Oh,
the
yes.
spouses, and you can catch PTSD like a cold. I've had so many people go, I've never been a policeman, I've never been in action, I've never been raped, but I have PTSD. Well,
Yeah.
if your husband comes back, throws you in a wall a few times, and you always feel stressed, what do you think it's doing for you? Nothing great.
Yeah.
And PTSD increases chance of sexual dysfunction in men 85%. That leads to joy feelings. So the way we treat in SOF, at least, I try to treat the guys and the women,
Mhm.
and sometimes the children, because
I think
it's
I
also
think you're really onto something. And I think we need to be I do think we've had more conversations in the last 2 years about families, than I think we ever had before, but I do think it's one of the and I think it's similar with the military, right? Like,
oh,
if
totally.
your spouse is a military member, you are a part of the military. And I think
You
same
know, the saying goes, the whole family goes to war,
Yes.
right? Same. Whenever there's a call and you have a decomposed baby you have to deal with, which is a lovely call to get,
Mhm.
and everybody is affected by that,
Yeah.
and
No,
you need
I
to respect it. So, but the advantage, I think, if those people, if you can do that study, I think absenteeism will be reduced, sexual dysfunction will be reduced, which leads to more happy families, but also alcoholism will be significantly reduced. We've been able to get rid of alcohol abuse a lot.
that's awesome.
People look at alcohol abuse as alcohol abuse disorder, whatever that is. I think that's crazy. That's just a symptom. So
Yeah.
you want to take a trouble for a swim, you can't drown it. It's going to come back anyway. Fix the underlying condition. And then shockingly, like we treated a seal that was drinking a liter a day of vodka for 10 years. We did the block, stopped drinking, no withdrawals. He did great.
That's amazing.
I mean, that
That
would
is
be something I would love to potentially look at. Is there a literature on secondary PTSD in family members of first responders?
not in family members. I mean, I think the closest we have is there's some emerging literature on, vicarious trauma in other groups, but not anywhere near
I
what we
hate
need
the
to be.
term anyway. That's
Yeah.
a good
Yeah.
term. It's like, ooh, I observed that. Ooh, baby. What does that vicarious trauma mean? I don't know. I mean, but that the implication that secondary PTSD vicarious trauma is the same thing. I think it's just a terrible term.
Yeah.
So maybe could we start with, or can you start with studying secondary PTSD, and maybe we'll find a funder who's interested in helping the families? That'd be lovely.
I I think it's a great idea. We've got to figure out we're having a hard time. We just launched our first study where we tried to survey spouses of volunteer firefighters, and we're just having a hard time getting them to take the survey to them. So I think we got to figure out how
Why?
to access that population better. Well, partly IRB, the way we set it up, we had to have the firefighters send it to their spouse. So we're
That's
still
not
working on it.
well.
I'm not giving up by any means.
If I may, let me give you advice. So I understand recruitment quite well. Uh, the best way to get to them is to get on podcasts.
Yeah.
There's a
Yeah.
lot of podcasts that firefighters do all the time, and police. So I assume you have a staff, yes?
Yes. Some really good ones.
You know what? Social media, they can actually, if you want, I really have a superb social media lady working with me. I've been in tons of podcasts. If you want to try to do it together, I'll do it with you. And,
That
can maybe we can connect the two social media people together.
Yeah. I've got a guy who's really done a good job of, like, taking things and breaking it down on the science side of stuff.
Well, this is, I mean, the great thing about secondary PTSD, I'll show you my drawing. I have a drawing that looks like, when you have the picture of transmission of viruses. So I have the same thing drawn, but it says PTSD in it. So the point is, scientifically, it's easy to understand. It's not a very
Mhm.
complex topic. I think what needs to be is if you have an IRB link, if you send it to me, I will distribute it as I go along. I'll put it on my website because I'm working on. By the way, I have to pitch my book. So this is
I was wondering. I saw it back there, but I didn't want to Google while we were. Tell me about that.
this beautiful new book. It's coming out February 17th. So the origin story of the term is cool. You like origin story? Let me tell you the origin
Love
story.
them.
So it's called The Gut Shot. Again, coming out in 2026 February. The reason I wrote that book is ultimately it's a book of hope, meaning you can get better. It gives specific. It's sciencey. It's not science. It's not boring. It's going to keep you. The writer did a great job. It cares about my origin story, but the rest of it talks about dogs with PTSD, secondary PTSD, all of that. Biology, the name change, all of that. Some of the stuff we've talked about. The name came about. I had a patient came in, he was a Marine, and he said one of his buddies had stellate ganglion block done, and he called it the gut shot because it changed lives, changes his life trajectory. So whatever the reason, so Frank referred somehow or other patient, Frank Hugbert, a patient to me for a stellate. Playboy wanted to have an expose about stellate ganglion block. Why Playboy? I have no idea. 2016. Anyway, so the name of the article was Gut Shot. So if you go on a website, theygutshotbook.com, you can see the Playboy article. You can look at some of the excerpts, whatever. I think it's the best work I've done by far.
Oh,
Uh,
that's awesome. I'm
so
excited for it to come out.
if you wouldn't mind spreading the word, I would love that.
So you send me the book and I'll send you a t-shirt.
Okay,
An
fine.
Einstein Fire
Can I
t-shirt.
show it? Then I'm going to ask one more thing. If I send you the book, you send me a t-shirt, can you put my website up on your social media?
Yeah. And when this gets posted, we can do a share that we had to talk. Yeah, I think that'd be awesome. I did find that quote though that
Yeah,
gosh
go
darn
ahead.
it.
Lay it on me.
Ah, hold
And it
on.
went away. What?
It went away. I just clicked it, but this is so you. This is so you.
Let's see.
Um, it's it was like I said, we just finished our conference and it was just like insanely like it was just really you got to come next year because it was just an awesome like engagement and just people felt
Send me information
I
because
will. They kept saying like I just felt like I belonged and no one was like just a firefighter or just a researcher. It was kind of like everyone did and we
yeah,
were talking about just like
but
wow,
talk
I
about
don't know how to pull this off.
getting your study done. That's the way to do it. You go to
Yes.
those things, and you. I think you and I together would be a pretty funny combination on the stage.
100% agree. Here's the quote. A pattern I've noticed in successful people. They're all a little bit delusional about their abilities, not arrogant, just unreasonably optimistic about what they can figure out. Isn't that great? I was like, yeah. Yeah. It goes on to say, well, everyone else is listing why something won't work. They're already trying it. Half the time they're wrong, but the other half, it changes their life. Reasonable people don't build unreasonable lives. And I was like,
That's cool.
reasonably optimistic. But
Uh,
that's you, right?
oh, absolutely. It just, you know what? Well, I think if I would say, I think one of the things that I find people who had difficult childhoods. I don't know about anything about yours, but it makes you more resilient to people critique. I'll tell you a cute story. So I was just finished my residency, my fellowship. I was like all gun ho, and I was presenting at this huge environment. There was 6 people at the table, presenters, and there was 1,000 people who are senior people in my space, anesthesiology. So I had this discussion. I presented this thing about succinylcholine, something complicated. Anyway, some weird thing happened. So I presented, and the guy next to me, the senior guy who's driving the ship, he says, "You're wrong. That's just not true." I was like, he takes a vote. Everybody in 1,000 people raise their hands. Now he's wrong. So I got up and I said, medicine is not a democracy. Facts are facts. If you have any complaints, come and see me. I'll show you the paper. As I walked out, my chairman goes, that is arrogant. However, I know when you say something, you always have a paper in the back pocket. I said,
Yeah.
I do.
And the data is just the data.
Nobody asked me. Nobody. Zero. The point is, that prepared me very well for telling me something that I'm completely stupid, I'm wrong, I'm an idiot, whatever. It's like fascinating information. Don't care.
Yeah. Yeah. Just stay there second guessing everything. What
Well,
were
if you
you?
second guess yourself, I will also, as I did trauma surgery for 2 years, if you second guess yourself, people will die.
Yeah.
It's just
Yeah.
that simple. You see it. I've seen, like, there are four of us in the unit. Three were good. One was like, oh, what do I do? People are just dying right and left, and people hated working with them. Anyway, so if you don't mind, let's close out. We don't want to
All
bore
right.
the audience too much. I would love to collaborate, and then could you send me your email and I'll send you some information? And maybe
Yes.
if you could send me your physical address, I'll send you something. I'll send you my physical address.
Okay. And the book
That's
in
why
exchange for a T-shirt.
that is why I need the physical address. That's how, I mean, for a PhD, you're a little slow
I'm
today.
just making sure because I'm just making sure that we're confirming in front of everyone
Yes,
listening
absolutely. I'm
the
signing it.
book for a T-shirt.
But why do you think I was asking for the physical address?
I just you said it wasn't until February. I just want to make sure we're on the
I'll
record.
figure something out to send you as long as you don't share. I'm going to stop this for a second. All right.